Welcome to this comprehensive video dedicated to understanding and addressing depression, anxiety, and panic attacks. We will explore these mental health challenges in depth and equip you with valuable strategies for managing and overcoming them. We will break these into separate topics in order to understand each of them better and come up with coping strategies for each. Let's start with a closer look at depression. Depression is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It often involves physical symptoms like changes in sleep and appetite, fatigue, and difficulty concentrating. Depression can significantly impact daily life and may require professional treatment for recovery. Depression isn't one-size-fits-all. We'll explore various types of depression, such as major depressive disorder, persistent depressive disorder, seasonal affective disorder, and more, shedding light on their unique characteristics. Here's a brief overview of some common types of depression. Major depressive disorder, MDD. MDD, often referred to as clinical depression, is one of the most common forms of depression. It is characterized by persistent and severe symptoms of depression that interfere with daily life. Symptoms include persistent sadness, loss of interest in activities, changes in appetite and sleep patterns, fatigue, feelings of guilt or worthlessness, difficulty concentrating, and thoughts of death or suicide. Symptoms typically can last between 6 and 18 months or longer. Persistent depressive disorder, dysthymia. Dysthymia is a chronic form of depression characterized by long-term, low-level symptoms that may not be as severe as MDD, but persist for an extended period, often 2 years or longer. Symptoms include feelings of hopelessness, low energy, poor self-esteem, changes in sleep and appetite, and difficulty making decisions. Symptoms persist for most of the day, for more days than not, over at least a 2-year period. Bipolar disorder, manic depression. Bipolar disorder involves extreme mood swings, including periods of intense highs, mania or hypomania, and lows, depression. Symptoms. During manic episodes, individuals may feel overly energetic, euphoric, and impulsive. Depressive episodes involve symptoms similar to major depressive disorder. Manic and depressive episodes can vary in duration and frequency. Seasonal affective disorder, SAD. SAD is a subtype of depression that occurs seasonally, typically in the fall and winter months when there is less natural sunlight. Symptoms include low energy, oversleeping, overeating, and weight gain during the specific season. Symptoms tend to resolve with the arrival of spring or increased exposure to sunlight. Psychotic depression. This form of depression includes severe depressive symptoms combined with psychosis, such as hallucinations, false sensory perceptions, or delusions, false beliefs. Symptoms include hallucinations, delusions, extreme sadness, agitation, and difficulty concentrating. Symptoms can be severe and persistent. Postpartum depression. Postpartum depression occurs in women after giving birth. It's linked to hormonal changes and the stress of childbirth and parenting. Symptoms include feelings of sadness, fatigue, irritability, changes in appetite and sleep patterns, and difficulty bonding with the baby. It can begin within weeks of childbirth and may last several months. Atypical depression. Atypical depression is characterized by mood reactivity, meaning that individuals may experience temporary mood improvements in response to positive events. Symptoms include oversleeping, overeating, fatigue, sensitivity to rejection, and a heavy feeling in the limbs. Premenstrual dysphoric disorder, PMDD. PMDD is a severe form of premenstrual syndrome, PMS, characterized by significant mood disturbances and physical symptoms that occur before menstruation. Symptoms include severe mood swings, irritability, fatigue, physical discomfort, and changes in sleep and appetite. Symptoms typically improve after the start of menstruation. These are some of the common types of depression, but there are other variations and subtypes as well. It's important to note that depression is a complex and individualized experience, and diagnosis and treatment should be conducted by qualified mental health professionals. Causes and risk factors. Understanding the root causes and risk factors for depression is crucial. We'll discuss the role of genetics, brain chemistry, life events, and other factors that contribute to the development of this condition. Genetics and family history. Genetics can play a significant role in predisposing individuals to depression. If you have a family history of depression, you may be at a higher risk. Research has shown that depression can run in families. Certain genes may make some people more susceptible to the condition when exposed to specific environmental triggers. Brain chemistry and neurotransmitters. Imbalances in brain chemicals, known as neurotransmitters, can contribute to depression. Neurotransmitters like serotonin, dopamine, and norepinephrine regulate mood. Low levels of these neurotransmitters have been linked to depression. Medications, such as antidepressants, often target these chemical imbalances. Life events and stress. Traumatic or highly stressful life events can trigger or exacerbate depression. Events like the loss of a loved one, relationship problems, financial difficulties, or job loss can lead to the onset of depressive symptoms. Chronic stress can also wear down the body's ability to cope, increasing vulnerability to depression. Physical health conditions. Chronic medical conditions can contribute to depression. Conditions like chronic pain, diabetes, heart disease, and neurological disorders can increase the risk of depression. The emotional toll of dealing with a chronic illness can be a significant factor. Hormonal changes. Hormonal fluctuations can influence mood and contribute to depression. Hormonal changes during puberty, pregnancy, the postpartum period, and menopause can affect mood regulation. Additionally, thyroid disorders can lead to depressive symptoms. Substance abuse and addiction. Substance abuse, including alcohol and drugs, can both cause and result from depression. Substance abuse can lead to chemical changes in the brain that increase the risk of depression. Conversely, individuals with depression may self-medicate with substances, leading to addiction. Personality traits and coping style. Certain personality traits and coping styles may be associated with a higher risk of depression. Traits like perfectionism, low self-esteem, and a pessimistic outlook on life can make individuals more susceptible to depression. People who have poor coping skills for dealing with stress may also be at greater risk. Childhood adversity. Childhood trauma and adversity can have a lasting impact on mental health. Experiences such as abuse, neglect, or witnessing violence during childhood can increase the likelihood of developing depression later in life. These early experiences can shape emotional regulation and coping abilities. Social isolation and lack of support. Social factors such as isolation and lack of support can contribute to depression. Loneliness and social isolation can be risk factors for depression. A lack of social support systems, including friends and family, can make it more challenging to cope with life's challenges. Gender and cultural factors. Gender and cultural factors can influence the prevalence and expression of depression. Depression can affect people of all genders and cultural backgrounds. However, there are variations in how it is experienced and expressed, and cultural norms can impact help-seeking behaviors. Understanding these causes and risk factors is essential for early identification and intervention. It's important to note that depression is a complex interplay of these factors, and not everyone exposed to risk factors will develop the condition. Seek professional help if you or someone you know is experiencing symptoms of depression, as early intervention can greatly improve outcomes. Treatments for depression. Psychotherapy, also called talk therapy. First, cognitive behavioral therapy, CBT. CBT helps individuals identify and challenge negative thought patterns and develop healthier thinking and behavioral patterns. Second, interpersonal therapy, IPT. IPT focuses on improving interpersonal relationships and communication skills to address depression. Third, psychodynamic therapy. This type of therapy explores the unconscious roots of depression and aims to provide insight into emotional conflicts. Medication, antidepressants. Medications like selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, can help balance neurotransmitter levels in the brain. It's important to consult a psychiatrist for proper medication management. Electroconvulsive therapy, ECT. ECT is a medical procedure that involves administering controlled electric currents to the brain. It is typically reserved for severe, treatment-resistant depression. Transcranial magnetic stimulation, TMS. TMS is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It is used for individuals with treatment-resistant depression. Coping strategies for depression. First, self-care. Prioritize self-care activities including regular exercise, a balanced diet, and adequate sleep. Physical well-being can significantly impact mood. Second, mindfulness and meditation. Practice mindfulness and meditation techniques to become more aware of and manage negative thoughts and emotions. Third, build a support system. Seek support from friends and family. Sharing your feelings and experiences with loved ones can provide emotional relief. Fourth, set realistic goals. Establish achievable daily or weekly goals. Small accomplishments can boost self-esteem and motivation. Fifth, limit stress. Identify sources of stress and find healthy ways to manage or reduce them. Stress management techniques such as deep breathing, yoga, or relaxation exercises can be beneficial. Sixth, engage in enjoyable activities. Participate in activities you once enjoyed or explore new interests. Engagement in hobbies and social activities can improve mood. Seventh, avoid alcohol and substance abuse. Refrain from excessive alcohol or substance use, as they can exacerbate depression symptoms. Eighth, create a routine. Establish a daily routine to provide structure and stability in your life. This can help reduce feelings of hopelessness and despair. Ninth, professional help. Don't hesitate to seek professional help if needed. Therapists, psychiatrists, or support groups can provide valuable guidance and support. 10th, education and self-help resources. Educate yourself about depression through reputable sources and self-help books. Understanding your condition can empower you to manage it more effectively. Remember that recovery from depression is often a gradual process, and it may require a combination of treatment modalities and coping strategies. It's important to consult with a mental health professional to determine the most suitable approach for your individual circumstances. Additionally, seeking help and support is a sign of strength, and you don't have to face depression alone.